Welcome to LYLAS. If you grew up in the 90s, you probably know what that stands for. And by default, this podcast is for you.
Welcome to episode 45. We've been on a little 2-week kind of hiatus. Hopefully, you've been catching up on all of our social media that we've been posting, putting out video content and everything over the last 2 weeks. We're really trying to, broaden our base and, make ourselves more accessible and our message greater to everybody. So hopefully, you've been keeping up with that. If you haven't, go back and check it out because we're trying to really pump things out.
Yeah, we're still learning. And even though this is episode 45, we kind of came out the gate with season 3, and we've just had a lot of shifts in our life, lots of travel, lots of job shifts. And so we needed to pause for the cause and just kind of get back ahead of the game a little bit. So this is February. We're in the new year, and we're kicking it off with one of the topics suggested by our listeners, which if you've taken the time to go to any of our social media pages and list potential topics, thank you from the bottom of our heart. I was floored when I logged or looked at our Google Drive. Sarah had updated it with all of the suggestions, and I was just blown away at the amazing suggestions, first of all, and the fact that people take time to write in and give us their thoughts and suggestions. So thank you so much. If you have done that, if you haven't, and you have some ideas, please go to our social media at the LYLAS podcast, and we'll talk about anything. So so put it on there. Sarah will add it to the list. She will likely send you some swag in the mail.
Definitely.
As a thank you. And yeah, so we're gonna kick it off. It was hard to choose a topic, quite honestly. There are so many good ones that have been suggested, but this one for some reason sort of stuck out to me. And so when we were talking about today's topic, I said, this is something that I think the majority of people deal with in their daily life. If you've made it to midlife, you have likely at some point in your life loved someone with a mental illness.
Yeah.
That's fair to say. I mean, this is your practice. And so, that most people at some point in their life are going to seek some kind of treatment for a mental health disorder. Is that fair to say? I mean, I don't have the statistics. I didn't look that up, but.
Yeah, I think that the general statistics kind of fall within the realm of 60 to 80% of Americans meet some form of criteria for a mental health condition. And by default, that means that all of us then know someone, whether it be within our friend group, our family group, coworkers, whatever, that does have some type of disruption in their life from a mental health based kind of condition, I think is fair to say.
Yeah. And I want to be just completely honest. I'm no different. I have a mental health disorder. I have multiple ones. I mean, totally honest. And so it does not discriminate, and it doesn't mean that that you can't be successful and live a fulfilled life. But in just being honest, I mean, I have certainly at times in my life really suffered from the symptoms that are associated with these disorders. And so our mission, part of this podcast mission, is to destigmatize mental health and the way that we talk about mental health, the way that we treat people that have these diagnoses, or just the way that we respond to people, because nobody asks to have anxiety or depression, or, we're not really talking about sort of the more severe, like bipolar. I mean, bipolar, schizophrenia, some of those things. But nobody asks for these things. No. And so remembering that if someone is truly suffering from a mental health disorder, they are in fact suffering. It's not pleasant. Symptoms aren't pleasant for anyone involved. But we had a listener write in and say, what about if you love somebody with a mental health disorder? What are some things that we can do? And so it really just got me thinking about what are some things that someone can do if someone you love is struggling, with symptoms. So we're going to dive into that today and just give you some tips that we have learned over the years in our personal life and our
Mm-hmm.
professional life.
Mm-hmm.
Um, so let's dive right in. Let's talk about it. What do you do if you love somebody and they are suffering from a mental health disorder?
Hmm. Wow. Even though we've
Step
been
one.
talking about it, right? It's the big pause right before you just jump right in. Um, I mean, I think the very first thing is that we have to be willing as the person who loves someone is to just recognize what's going on and to really take some time and talk with our loved one and learn about what's going on with them.
Mm,
Because
mm-hmm.
otherwise, that can lead to so many misjudgments about the behavior that we may be seeing, which is maybe part of the symptomology of whatever is going on, you know? And so
Yeah.
it is so important from the loved one's perspective to be open, to be non-judgmental, to be this is someone you love, so it's about being accepting, it's about reaching out, and being willing to truly listen and then educate yourself on what may be going on. And that can be really difficult and it can be really tough, especially if you don't know. Like, let's say this person has not went to any type of mental health professional or to their primary care doctor and doesn't know what's going on. So you don't have a necessary label to kind of stick on to what you see. But it's just the encouragement and I think support to initially get help and then to educate is got to be the first steps.
Yeah, and I think that you know we forget how powerful empathy really is for
Mm-hmm.
someone. And empathy is really just acknowledging that someone is hurting and that you don't know how to help them, but that it hurts you to see them hurting, that you don't want that for them, that you care about them and love them enough that you want to see them being their best selves
Mm-hmm.
and living their purpose. And so acknowledging that and saying, you don't have to have the answers. You don't have to be the person that fixes it, even though so many of us want to fix. You see a problem, you want to fix it, but you don't have to be that person for your loved one. And we'll
Mm-hmm.
talk about how you can support them in other ways. But I think just step one is like that empathy piece of I see you and I'm sorry and I don't know how to help you, but I care about you and I have enough empathy for you to support you through this
Mm-hmm.
because it's hard. No, I mean it's hard for the person. It's hard for the people that love them. I think of it so similar to loving somebody with an addiction,
Mm-hmm.
uh, or loving someone that has like a, maybe they have like a terminal illness. I mean, there's a lot of similarities in how the person that loves them might feel or how they may be trying to support them. And so there's a lot of overlap, I think. And we talked a lot when we had Craig on
Mm-hmm.
episode 20. If you love somebody that is struggling with addiction and you haven't listened to episode 20, make sure you go back and listen to that because he gives some great tips or just, it's a great episode. But also I think just overlaps in a lot of
Mm-hmm.
ways of, you can't fix somebody
Mm-hmm.
but you can still care about them and show them support in other ways.
Absolutely. And that is tough, especially whenever you're the parent or,
Mhm.
you know what I mean? You're the spouse of someone. And maybe you've even kind of played that role in different points of time within someone's life, not necessarily as a fixer, but as a helper.
Mm,
And that's kind of the same idea that I think we want to try to go with, but to know that the true, I guess, empowerment of the situation comes from your openness and empathy, is what you were saying. And
mm-hmm.
that is 100% fact. And the other thing that I want to pick up on that you mentioned, I think is really important, just from a destigmatization kind of standpoint, is that, you know, we don't treat people with medical conditions the same way that we do with mental conditions. And I use these little air
Mm,
quotes. So if you're listening to this, I use my hands, even though we're recording an auditory podcast. Um, but I think as long as we continue to treat those two things as being separate, then we are creating a greater gap whenever it comes to care, not only in terms of access to providers, but people seeking treatment. And so
Yes.
I've always worked within an integrated care situation. So it was never, there was no, we were all specialty medicine. And I just happened to be one form of specialty medicine that people went to within our environment. And all of the physicians that I worked with also understood that as being the case. And then talking with patients and helping them to kind of understand that, hey, this condition is just like managing diabetes. It's just like managing cholesterol. It's just like managing these other things that do have an impact on you as well as your family, but let's work with it, you know?
Mm-hmm.
And to kind of add as an example, oftentimes whenever someone is diagnosed with a medical condition, it requires some level of lifestyle change that affects their family,
Yeah.
right? Or could, and
Great
it could
point.
even, yeah, or it could even serve as a barrier to them actually following through with a treatment plan. Well, guess what? The same is the same is the same. And so
Mhm.
if we continue to treat these things as being necessarily different, then we're really not helping. I don't know anyone at that kind of point. So,
Yeah. And I think when you love somebody, and I'm going to speak from personal experience here, because
mm-hmm,
if you've listened to our very first episode, or the one that I talked about, the Ferris wheel of hell of experiencing panic attacks, I think about my husband in that case. That could not have been easy for him, right? To
mm-hmm,
watch his wife like really struggling and not be able to help me or to know what to do. But he always, validated, even though he couldn't see what I was feeling on the inside. He was validating that he could see that I was hurting, and that, you know, um, knowing that he had to like swoop in and take care of the kids, and really provide that sort of, I guess validation is really the only word I can think of. But like, even though you can't see what's happening in their mind, let's say it's someone who is suffering from depression and they
mm-hmm,
can't get out of bed. You can't see their feelings, but they're not getting out of bed. And so being that support, and that doesn't mean saying, just get out of bed, things will get better. If they physically cannot move their body out of bed, um, you know, they're suffering, and
mm-hmm,
it's a symptom, and it's not easy to watch somebody and think, well, just get out of bed.
right,
If you've never experienced it, it's really hard to understand what that feels like.
mm-hmm,
To not be able to stop, thoughts that are racing through your head, to not be able to calm your heart rate down, to not be able to do things like that. So, that validation piece is huge in just acknowledging that, because when you're experiencing things like that, you often feel crazy.
oh yeah, mm-hmm,
And and so that acknowledgement piece also comes from, you're clearly experiencing something, even though I can't see it necessarily. But I'm here and I'm going to support you in the best ways that I can. It's
mm-hmm,
hard, and you need people kind of rallying around you for yourself as that loved one, but also for that person.
mm-hmm,
It's no different than if you have a terminal illness, or if you are in recovery. You need a community of people that you can fall back to and get support from, because you can't only rely on each other if it's a
right,
loved one, whether that's a parent, a child, any form of relationship.
mm-hmm,
You're going to have to at some point have a community of people that support you as well.
right, right. And to credit your point with this, I mean, you know, I thank God all the time for Jeff and the way that he responded to you. You know what I mean? In that moment, because I'm over here 2,000 miles away. You have other friends and things like that who are there close to you, but no one knows what's going on with you within your home. And the
Right.
fact that he had such a warm, loving, validating, empathetic response, that was the key in that moment to helping to get this ball moving in a different direction. You know,
Mhm.
had he had a different response to that, who knows? We would probably be doing this podcast. Who knows what would be happening? But
Yeah.
he beautifully, just innately within him, just loves you and knew how to respond in that moment. And that's the kind of grace that I think is important for all
Mm.
of us to consider as just walking with, as people with compassionate hearts for
Mhm.
others. If we see that there is some level of like behaviors change or struggle or anything kind of going on with another person, to walk to them with that openness and love. I think is
Mm.
important because we just don't know what's going on. And so to immediately shut it down or assume somebody's being dramatic or it's just that time of the month or whatever kind of line of thought that people tend to kind of go down, that openness, I think, is the very most important kind of step to have in approaching somebody, because that then opens the door for understanding, empathy, seeking help, treatment. It even affects compliance rates as to how well a person within your life responds to whatever condition you have, dictates a lot of times how well you take care of yourself in the moments thereafter.
Mm.
So it's just really, really important as us all walking through life with compassionate hearts to maybe kind of keep that in mind whenever we may find ourselves within that position. So,
Yeah, and that's, he has no mental health training. My husband is in a completely different line of work. He has a very engineering mind, very we're very different, in
mm-hmm,
that way. Complementary, I like to say.
mm-hmm,
But he doesn't. But you made a good point in that he realized he saw a change in behavior. And a lot of times we recognize if a friend is acting differently, if a child is acting differently, and we know as mental health professionals that that is a huge indicator that something is going on.
mm-hmm,
But just noticing those things, um, I think is step one, is you're identifying that this person is behaving abnormally for them,
mm-hmm,
not abnormally, but different from how you've always known them to behave. Or maybe not. Maybe they were already experiencing mental health issues when you entered a relationship with that person. Maybe it's all you've ever known.
mm-hmm,
So that kind of takes a different form. But if you've been with someone and it is sort of a new experience or a new diagnosis, you're likely going to see a change in behavior. And and so I think that that's key in just like that he recognized like, whoa,
mm-hmm.
this is way different than I've ever seen her behave. She's hormonal as hell. She's real bitchy right before she gets her period, but this is something different, you know?
Yeah,
Um,
but
and
that's
so that
fair. Mm-hmm,
right. That's just paying attention to your loved ones, which I think we all kind of do.
mm-hmm,
Like
mm-hmm.
when something's off, something's just not quite right. Sometimes it's very obvious, but it's been almost a year since I've experienced a panic attack, and I think about the last one I had. He almost immediately picked up on it even before I did, that he knew
mm-hmm,
something. Are you okay? And I was like, it's funny you say that. I'm getting those like racing thoughts and my heart's racing, all those things. And so just that awareness, I
mm-hmm,
think then it leads into that empathy and that validation and all of those things that really take, that's not hard. Those are pretty easy things to
mm-hmm,
acknowledge, even if you don't agree with the way they're behaving. Let's say like it's a set of behaviors that is um, unenjoyable for the other
mm-hmm,
person.
mm-hmm.
Maybe they're screaming at someone and that's abnormal, whatever it is. You don't have to agree with the behavior, but you can still validate their feelings. Does that make sense?
Yeah, yeah, I think that it does. And I think that, especially whenever it comes down to behaviors that can be, um, later on after, a diagnosis or whatever, like disruptive, then those are points of, that could be points of intervention, or
Mm-hmm.
just awareness to kind of help as part of that process. But to credit your point too, for you to a year ago have been sitting there and for him to have said, "Hey, are you okay?" And then for you to have been like brave enough to sit there and say, "Actually, no." That
Mm-hmm.
is huge because most people don't feel comfortable enough within their relationship to express that, but more importantly, maybe they don't necessarily feel, I don't know if it feel okay enough saying it about themselves in those moments. And so for you to do that, that is a huge, huge and remarkable thing. Like that's the key right there, and the way that then you respond changes because of that. And that's so
Yeah.
important.
I think, I mean, again, I really only have anxiety and panic attacks to kind of speak from. I don't know what it's like necessarily to deal with
Mm-hmm.
depression. And I think that's a huge mental health disorder that a lot of people struggle with. I know anxiety is a huge mental health disorder that
Mm-hmm.
people are struggling with. ADHD is in the DSM. You
Mm-hmm.
know, it's not quite as much of a struggle. It can be. It can overlap in a lot of symptoms that of anxiety and depression. There's a lot of overlap there, but at the end of the day, for me personally, when you're in one and experiencing it, it is you're constantly deciding, do I need to go to the emergency room? Is
Mm-hmm.
this more than something going on between my ears? Or am I like, you think all the things. Am I having a brain aneurysm? Is this a heart?
Mm-hmm.
Because you are experiencing so many different feelings. And,
Mm-hmm.
um, for me, I had to get to a point where I was like, yeah, I might need you to take me to the hospital. Like, and I've never, knock on wood, besides giving birth, been in a hospital.
Wow.
Um, and so, yeah, right. Lucky. I count that as a blessing. Great.
Yeah.
There's some gratitude for that. So, but anyway, I just think that um, it sort of forced me to,
Mm-hmm.
in some ways, when you're that worked up and concerned about what's happening inside your body, that you have to. Now, like depression, I don't know what that feels like necessarily.
Mm-hmm.
And so that's, I don't know if you would have the same comfort saying like, I just can't get out of bed today or whatever,
Mm-hmm.
your symptom is. But remembering that a lot of people are really struggling and they're not talking about it.
Yeah.
And we know that's true because we know that the suicide rate in this country is higher than the homicide rate. So people are experiencing debilitating behaviors on a daily basis and they're
Mm-hmm.
probably not talking about it. I wasn't going to work and talking to my coworkers about it. I was talking to a select few, but I wasn't like broadcasting the fact that I was having panic attacks.
Sure.
Um, or lifelong symptoms of anxiety. Like I didn't really talk about it to people. If they
Mm-hmm.
asked, I would tell. But so just remembering that people really are struggling and that idea that like, hey, if you just try harder, do some yoga, is yoga something you could incorporate to your life as part of your treatment plan? Sure.
Sure.
But that's not going to, if someone is really struggling with symptoms, that's not going
Mm-mm.
to cure them.
No. And I think that from a patient kind of standpoint, the first step has to be is seeking help. And I know that
Mm,
that is the hardest step to kind of go through and do, but it is the most essential one on getting into a place of greater coping, wellness, everything. Um, Mental health conditions tend to be this is the number one reason for disability
mm,
within the US. Sometimes it goes back and forth between that and like pain based disorders, but there's always
mm,
usually a secondary diagnosis of depression that carries along with it. So
sure.
think about that effect on the workplace, the economy, families, homes, everything. And
Mm,
really going into and seeking some type of help. If you were that person, that is the first and best step. And people are always asked, like, where do I go? So your
mm,
primary care physician is the number one. That's the entry point a lot of times for people to get to some type of other specialty provider. And
mhm,
so that's the way that I kind of conceptualize things. I mean, my primary care doctor does not manage my diabetes. That's not the specialty. They manage
right.
something else. But that was the first step in getting help and care. So I
Mhm,
had symptoms. I probably should have went to the hospital, but didn't. Went to a primary care doctor, and then I was able to get help and treatment from there.
yeah.
And that is the quickest and easiest way in order to get a foot in the door. If it is not something that is quite as severe. And so
Yeah.
that needs to happen from a loved one based perspective. Um, to say two things. One, you are in a completely and totally different role if this is your child and they are under the age of 18,
Mhm,
as opposed to if this is your child and they are 25 or 35. And that is a different place as a parent to kind of be and comes with its own set of worries, anxieties.
mm,
Really life debilitating, almost secondary symptoms of someone else going through something difficult. So they a lot of times can be, almost medically considered a secondary patient of someone who is going through something difficult because of the amount of distress that equates to within their point of life. So, and that's,
Yeah,
yeah, I just say so much of that's just due to a lack of control. You just don't have it anymore.
you don't have the control. And I think that's hard when you love somebody that's struggling with addiction. I mean, for anyone, if it's a parent or uh, spouse or a child, I mean, there is nothing that, well, I mean, I'm sure there are things, but it is so difficult to love somebody that is struggling
Mm-hmm.
and to watch them and know that you can't fix it.
Yeah.
And so just acknowledging that in yourself that you are feeling that way and giving yourself some grace for that of you know you can't fix it.
Mm-hmm.
But that's hard. That shit is hard. I
Oh,
mean,
yeah.
it's brutal. And I think even though we're kind of vacillating here between like mental health and health conditions and addiction. Like I said, I feel like they're so intertwined in so many ways
Mm-hmm.
because that powerless feeling is hard. And like you
Mm-hmm.
said, you can almost take on your own sort of symptoms and issues. I'm going through a situation right now where someone I care deeply for is very ill, and
Mm-hmm.
there's nothing I can do about it. And I'm not sure how to support this person or their family, and so you're just kind of taking it day by day. But I think it's very similar to loving
Mm-hmm.
some with some sort of other mental health condition or something else, in that you can just sort of go through these steps that we're talking about. Like, am I going to call and recommend a treatment? That's one of the things we're going to talk about.
Mm-hmm.
No, because this is a different situation. But there are other things that you can do to show somebody you care, that you still support them in their battle, because ultimately it is their battle
Mm-hmm.
and
It is.
that they have to take ownership for, and 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 they have to seek treatment. You can't force anybody into any kind of treatment.
Mm-hmm.
What you might be able to do is some research and provide them with just what you have found. Not like I think you should do it, but here's some options that I came across. I don't know if
Mm-hmm.
you've found these. Maybe you want to take a look at these.
Yeah.
That might be just something that you can do, because I'm very much, I'm a believer of having a whole treatment plan, like how Sarah used to practice,
Mm-hmm.
of working together. I think medicine has a part. If you are suffering, I think you seek medical attention for those symptoms.
Mm-hmm.
I think that will fix your mental health problem. I do not. I think that it is a full treatment plan that includes lots of things.
Mm-hmm.
Um, might include individual counseling. It might include group counseling. It might include, um, you know, meditation like that. I think
Mm-hmm.
about a personal treatment plan for how I manage my anxiety and panic disorder, and that's 100% part of my treatment plan.
Right.
And so you really can't force someone to seek a certain type of treatment, but you can certainly help them research. Because one thing, let's say you're struggling with depression,
Mm-hmm.
probably don't have the energy to research what to do for depression, or
Mm-hmm.
where you might not, you might even say, hey, I'd be happy to call and make this appointment for you, because they might need that. They don't have the energy perhaps to do things, but you have to let them lead and
Yeah.
let them say, yes, I need help, and
Mm-hmm.
you to do that for me.
Yeah. And so much of that too is almost dependent on what's going on with that person and individual too, because I know that whenever I was the director of a substance abuse program, and this was during the height of I don't know that maybe it continues to go up, but the real height of the opioid epidemic in West
Mm.
Virginia. And I was running a clinic that used MAT treatment as one of the helpers, assistants in it, in addition to individual and group counseling and use of AA, NA based groups. So it was a whole comprehensive program. We would have numerous times I would have a parent call, and want to speak with me, and they would be like, I have to get my son into this program. They are 25 years old and they are going to die. I am watching them die. They've Narcaned them. I don't know how many times we've taken them to the hospital. You know, we need to do something. And my conversation with them would be, that is an incredibly difficult situation and you cannot call for them.
Right.
And so here are some options that, you know, for you, this is very challenging and difficult. We'd be happy to schedule an appointment to have you come into the office so that way we can talk with you about how you can kind of cope with what's going on. And they have to be the one to do it.
Yeah.
But that has to be the first step, especially I think whenever it comes to addiction kind of based things, is you have to be that person to make that initiating call. Now, sometimes we can file a mental hygiene on whatever. I mean, this gets in the weeds real quick, but it's one of those things that, again, it's the secondary person sometimes that ends up being the patient, sometimes because of the severity of things that are kind of going on and happening within someone else's life. But it's making that phone call or showing up for that appointment has got to be real dependent on the person kind of following through with it. So, and it's tough. It's tough all
the way around. But I think if you're aware of the symptoms that they're experiencing and you're able to just kind of like acknowledge when it's happening, you know, because we tend to take everything so personally. And again, I'm always going to fall back on personal experiences here, but you know, my husband easily could have taken it personally when I was like not able to cook dinner or not being with our children. He could have been like, oh, great, I get to do everything. But he clearly had recognized at that point that I was experiencing significant distress and that I needed support. And so, again, I think maybe it's a little bit easier because of the symptoms that I was having. But just acknowledging that, oh, this person is having symptoms of this disorder right now. And, you know, that it's not a personal attack on me or our relationship, or that this is, you know, just who they are, that this is something that they're experiencing. And like everything, nothing lasts forever.
right.
And hopefully that, you know, the person that you know and love is going to come back and you'll be able to talk and say, hey, I noticed that you were really struggling there today. I don't, you know, I'm not sure how to help you, but like, and I remember Jeff saying like, are you ready to go see somebody about this? Is it time? Like, this is happening a lot. And I needed that. I needed somebody, I think, just to acknowledge that, like, that they could see that it was happening, because you feel like it's all inside your head, right? You think it's like, hey, that you're maybe not showing it through behavior, even though we know that we are. If you're curled in the fetal position, that's a behavior, and you're demonstrating distress. And so, you know, even if it may be a little bit more subtle, but just acknowledging or being able to recognize those symptoms might help not take it so personally, like it's an attack on you from your loved one.
Absolutely. I mean, again, no one is doing this because they're choosing to. You know what I mean? You're not asking for it. And your point is that two seasons, we go through different seasons, we go through different experiences of severity, no matter what condition that we have. And as a loved one of anyone with any condition, coming to it with that open, compassionate heart, I think is the most important thing. And then, you know, he gently, it sounds like, encouraged other forms of assistance while acknowledging that he had no power or control over it too. And so how great of a balance between two things that is. I have no power and control over what's happening, and I love you very much and want better. How can we now move to the next step?
Right.
And that, I think, is a beautiful example of approaching this situation. So if you are in this situation and want to know how to approach it, there's the playbook, right? That's it. If you've been in it and maybe you're like, damn it, I screwed this thing up. No, you haven't. It's never too late to kind of come back to somebody and be like, you know what? I've screwed up.
Yeah.
And I have not been as open and understanding and considerate as I should have been. And I'm sorry.
Mm.
So even if you've been down this road for years, there's nothing wrong with taking a restart and kind of going back to that point. Because again, we don't know what role we as individuals are playing in someone else's life. We have an idea as like a husband, a spouse, a friend,
Mm-hmm.
whatever, but we have no idea the emotional or the influential role that we're playing in their life. And
Mm-hmm.
sometimes just kind of going back to that point and saying, hey, you know, I messed up. I could have done better. I'm here now and I want to now know, what can I do better to help you? What can I do better to help this situation or to be more supportive when X, Y, and Z happens? So if you're in this boat, there's the playbook. If you've been in this boat for 10 years, it doesn't mean that the ship has sailed. There is still ways
Yeah.
to kind of come back to shore and reapproach as you then set forth on this next part of the journey.
And give yourself some credit for the fact that
Mhm.
you have been there supporting somebody that is
Mhm.
struggling all this time, whether they've been struggling with a health medical issue, a mental health issue, an addiction issue, whatever it is that someone is struggling with. If you have stuck by them, and you know, and that goes for parents and children um, and spouses, all the things. Give yourself some credit for that, because I truly believe when we know better, we do better.
Yeah.
And if you didn't know how to support somebody, that's okay. When you were talking, I was like, if I could go back and tell 20 something Jenny what we've talked about today, that would have helped me immensely when my dad
Mhm.
was really struggling with alcoholism and what I believe to be mental health disorders.
Mhm.
He had several instances in his life that I believe would have qualified him for those things.
Mhm.
Um, and I think that it would have been so helpful to realize that it wasn't on me to try to fix it. It was
Mhm.
such a dark time, to watch someone that you have tremendous love for and compassion for feel like they're self imploding. Like I felt
Mhm.
like he was making choices that were just literally blowing up his life in some ways. And now I see things so differently,
Mhm.
and I've learned a lot in the last 20 years. And so, but I think it's a good point to always give yourself grace for that. You didn't know,
Mhm.
and so that's okay.
Yeah.
We're not experts on everything at the age of 27. But when you know better, you do better. And so you now have hopefully some tools that you can use if you are experiencing this with a loved one, some things that you can
Mhm.
out to help support them and really get your self support. I think that
Yeah.
was something I wish I would have, someone at some point suggested to me. I think it's called like Al Anon,
Mhm.
but it's for the loved ones of someone that is an addict.
Mhm.
Um, and it basically it's a support group. So it's no different really than going to like an AA meeting, but you're going there to be a support person for other people dealing with the same, um, issue with their
Yeah.
loved ones. And so I'm sure there's one out there. I'm sure there's many support groups for
Mhm.
all of the different types of mental health issues. If you've got somebody that you love that is struggling with like schizophrenia, or,
Mhm.
that's a very small portion of the population, but bipolar disorder. I mean, I think that goes, we've talked about that in previous episodes, but
Mhm.
if you truly love someone that is experiencing or has a diagnosis, I'm certain there are support groups
Mhm.
out there.
Mhm. Yeah.
And you're going to need that. You're going to need people that you can trust that maybe aren't in your close circle or
Mhm.
family, people that you can talk to that are experiencing the same types of things, and really make sure that you have support as someone that loves somebody struggling with
Mhm.
mental health.
Yeah. Yeah. And that is key. And again, I would say that a lot of patients that I saw were the secondary patients of someone
Mm.
who they loved who was struggling with something. It may have been cancer, it may have been, you know, diabetes, or it may have been depression. It may have been anxiety. It may have been bipolar disorder or schizophrenia or, um, a whole host of other things. And they just didn't know how to kind of best cope with it. On the flip side of it, as a provider, what I would try to do and encourage the folks that I would talk to is that your wellness plan is comprehensive. And and that is so important. So if you are a patient right now and you do not have a comprehensive plan, then you need one. And a comprehensive plan means that you have knowledge and education about what's going on with you. Okay. Again, from a medical side of it, as something that I have experience with, if you're a type 1 diabetic, you don't get discharged from the hospital until you learn how to give yourself a shot. Your parents, if you're a child, have to take a test on how to manage your condition before you get discharged from the hospital.
Yeah.
We don't do that for kids with depression. We don't do that for kids with anxiety. Do I think we should? Yeah, I think there should be some more of an educative component with it. Maybe not as strict as that, but something. But as a patient, you knowing what's going on with you, you knowing what's going on with your symptoms, and then you knowing the full scale of the treatment plan. Part of the treatment plan, again, may be medication. It may be that we're doing different modalities of therapeutic interventions or whatever, that we're doing like a behavior activation when we are getting up, we are getting out of bed, we're going to have these parameters set on things. But the other piece of it is that, okay, how are we going to talk to our family and our loved ones about what to do? Because some of the time, whenever I would be in session with people, they would be like, well, I tried to do this, but then they did that. And so, which made everything worse, but without cruel intentions on anyone. You might have had really unfortunate set of behaviors here, which caused an unfortunate set of behaviors. All things suck. Okay. But what can we do? Right? What can we do? And so that was a big piece, is that, okay, well, maybe let's assume that these people are well-meaning and that they love and that they care about you. Yeah. How can we best educate them on how to respond when these things happen? And then I would empower them with the decision to, do you think that you can talk with them about this, or do you want me to intervene? And I would put that in their hands. I've always got your back, but I'm not going, you know what I mean? You need to be the one to make the decision about which path is going to be the best and easiest for you. And we may spend weeks on kind of coming up with a plan on this, but it is that kind of, again, proactive piece to it that then really helps in those moments. So maybe then, if you did not have a supportive spouse, or you didn't have like a parent that was real receptive to understanding what was going on, or whatever the situation may be, you then taking the opportunity to be like, hey, when X happens, I literally have no control over what's going on. Okay. And this might be a more helpful response to me. Can we try that next time? If my blood sugar's 40 and you're asking me to, I don't know, walk to the garage, you better watch me walk to the garage.
Right.
What's I've done the plan? Right. What's the plan?
Yeah.
But that then opens a door for greater opportunity, understanding, and then, helpfulness just on down the road. And so the doors don't constantly feel like they're being shut. Now, if they are, then we got a different discussion to have,
right.
Maybe on both sides of the train, but it's just really, really hopeful that if you have a comprehensive plan, then you learning how to talk with your loved ones about what's going on and how they can best help you is a piece of that plan.
Agreed. I got a question for you because it just popped in my head and I feel like it's important. But if let's say you're entering a relationship with somebody and you carry a diagnosis of depression and it's fairly managed and you take medications, and let's say you have a great treatment plan and your symptoms are managed. Do you believe that you should disclose that and you're entering a serious relationship? This is not, I'm not saying go, tell everyone your medical record, but like, do you feel like it's important to let the other person know, hey, I have this diagnosis, and let them know sort of that you're in treatment and that it's managed? But do you think that's fair, or do you think that you write it out and say, yeah?
No, I say this from personal experience too. And again, I don't I don't differentiate between medical and mental. I do it sometimes in
Right.
language just because it helps those who I'm talking with, but as a human being, I don't differentiate the two. I see us as
Sure.
one whole body of interacting systems. Um, Whenever I first started dating my husband, it might have even been on like, I don't know, day one, probably day one, honestly. Um, I told him, I was like, look, I'm a type 1 diabetic. At that point, I was wearing an insulin pump. I hadn't dated in a bit, and I'm thinking, in my head, I'm all the way down the road to this guy's hot. I maybe want to have sex with him at some point in time, but then I got this device. In all fairness and disclosure, you go through all thoughts happen to
Sure.
everybody, right? Everybody's head
Sure.
goes down a road. And it's like, okay, well, we just need to get this out of the open. Plus,
Right.
it's a condition where my symptoms may require whoever I'm with at that point in time to assist.
Yeah.
And that is a point of vulnerability. It's a point of me surrendering the fact that there are points in time in my life that I don't have control, but I need to have supportive people in my life who can respond in those moments. And I, as a human being, am just not willing from the go to have somebody in my life who is not able to meet that first criteria as a person.
Yeah.
And that's just, again, I take a real hard stance on a lot of things, but that was one of them. Like if we're even like just even talking about like going on dates, I'm at a point in my life, first off, where I'm not going to be a forever girlfriend. I'm not like a one night stand kind of fling around kind of a thing. But it was important for me to tell him from the go that this is if you are liking, if you are liking me, then you need to like all of me. And you need to know that this piece is a part of it. And even whenever I would work with young adults, because I worked with adolescents through geriatrics was my kind of zone. And, they would be like, I really like this guy, but, I've got some of them had a lot of trauma history that was coming along with it. And so we'd first kind of like, is this really a good dude? Like, what are we doing here? You know what I mean? We'd have a real kind of candid conversation about maybe what was going on. But then a piece of it was like, well, listen, if you're really having all these feels, then you owe it to yourself, not to the other person. You owe it to yourself to start out the relationship with someone who is going to be kind, compassionate, and understanding from the get-go. And if they're not, then I get it. Really cute and really pretty, but let's pass. And so that's kind of my advice on things. Like if you're really considering having a serious relationship with someone else, then if you want to invite them in your life, they need to love and be aware of all of you. And I think that's you empowering yourself to have good people in your life. That's you taking the first step on making sure you have a great support system of people. And there you go. You may find out that you're wrong. Who knows?
Well, and I think it also acknowledges that you are not a disorder, right? Right. That's like one very small piece to the puzzle. And that, it comes along with you and that's part of it. And that, I just need you to know this. But like you said, if they love you, they're going to love every part of you and you're going to need them at some point. And so just being honest from the get rip of like, this is something that I manage, but you need to know that it's a part of who I am. And, at some point I might need support from you.
Right.
Like I said, because, it may be that you already have a diagnosis when you enter into a relationship. It might be that it's something that comes out many, many years later. But if we're ever going to destigmatize mental health issues and diagnoses, we've got to stop almost making it bigger than it is. Like it's one part of it. It's one part of who we are. There is hope. There is a plethora of treatment options out there. And when you find the right combination, you can live a very successful, healthy, fulfilled life. I feel like I'm the perfect example of that. That's not to say that I'm never going to experience symptoms again, but it it doesn't stop me. I'm trying every day and working the plan and working a treatment program. So always something to consider if you yourself or someone you're thinking, well, I don't want to disclose that on date one. I'm not saying date one, but something to consider if it is somebody that you truly care about and see yourself with for an extended period of time.
Yeah. And I think it's because you owe it to yourself to have that person, a person that has those qualities, not that person, but a person that has those qualities within your life. You owe that to yourself.
Yeah.
That's the way that I would kind of frame it, I would say.
Like respect yourself enough
Yeah.
to find a partner that is going to be supportive for you.
100%. Yeah. And whenever that moment happens, I can tell you that it's the most, like what you found whenever Jeff was so compassionate and, you know what I mean, just open to you. Whenever I told my Jeff, he was like, so what? And I was like, well, that wasn't the response that I was, you know what I mean? Like, what are you so what in here, pal, you know? But it turned out he was around type 1 diabetics his entire life, which is a rarity in and of itself. But I was like, well, hell, God just put you in my path, you know, for a reason. There's nobody in this. Yeah, there's nobody in this world that's better equipped to deal with me and my bullshit, you know, or our son's little, I mean, he's really good too. Issues whenever he has them than you. So this is great, you know?
Yeah.
But, and that to me was just like a solidifying moment. You know what I mean? Like if this is the qualities of a human being that I want in my life, and this person just met that criteria right there, then okay, we can now take this to a deeper level. You know what I mean? We can now go on to the next stage of the game. So, but I think that that's important.
Let's talk about real quick before we wrap this up, because I want to get your opinion on this. But let's say you love someone who clearly displays symptoms of some type of mental health disorder. And I'm not saying that, by no means do I feel like we need to be diagnosing our loved ones. We've talked about that previously, that should be left to the professional community. However, let's say you have you see, maybe you're observing somebody struggling with panic attacks. We'll just use that. I'm familiar, but they're resistant to seeking treatment. What would you say to somebody that loves someone? Let's say I had not ever gone. What would you have said to somebody like my husband, who was obviously able to recognize something was happening, but the person was just not interested in seeking treatment?
The health of every individual is important to me. The health and well-being of every individual is important to me. And it may, whatever it is, what it is. A lot of, again, maybe secondary patients that I would see were in situations where their loved one did not recognize, did not want, or in some way, shape, or form was treatment non-compliant, as some people will reference. Different places will say it is treatment interfering behaviors, whatever. The fact of the matter is that they weren't following the plan. You don't have to stay in a relationship where someone doesn't take care of themselves. And that was always a very hard discussion to have, because here I am, you know, as a mental health kind of professional, so to speak, right, who is an advocate for people. Your patients. But my patients are both. You know what I mean? My patient is the addict and the parent of the addict.
Yeah.
So never would I see both at the same time, but I'm just saying that they're both. And so at some point in time, I do not believe that it is healthy for you to stay in a relationship with someone who is not taking care of themselves or following a plan. So if I was constantly, you know, eating the wrong things, not testing my blood sugar, whatever, that I'm not living up to my end of the deal here. I have a condition. It is my responsibility to take care of it. I'm not going to use my condition as a reason why I can or cannot do things. And I would even tell my patients, it does not matter what, you know, we're dealing with here. We're not going to give it the power over our lives. We're going to give it the respect that it needs within our lives. Right. But we're not going to give it the power over us. And so that would be, again, me, as if I'm a very hard provider, or was. And so I was like, this is part of our contract here. Like, this is part of, if you want to go to somebody else, they may take a different approach on it. You're more than free to do that, you know? but I'm not changing the plan here. Okay. You can change providers, but I'm not changing what I'm doing.
Yeah.
But that was just the fact. And so there are many cases where, they were in that position where they were with somebody who was not following through, not getting help, constantly non-compliant, hurting other people within their lives due to their due to them not taking care of themselves. Let's put it
Yeah.
that way. And at that point, children could be involved in it, work, all different kinds of other relationships then start to kind of be affected by it. And that's where, again, I care about the health and well-being of all people. And I'm not going to sit there and advocate for that person to stay in that relationship whenever this person is not doing what they need to do. But we try everything. You go to the end of the road, and whenever you keep getting met with opposition and resistance, is that a potential symptom of that maybe condition? Perhaps, but if somebody is also getting treatment for it or is willing to accept the treatment plan for it, then it can be better managed. So don't let that be somebody else's excuse. Well, I have this going on. You don't know how hard it is, X, Y, and Z. You're correct. I have no idea. And I know that there are other things that we can be doing to kind of help this. And we've tried and tried it, whatever the case may be. It is not healthy for some people to stay in those situations. And that's where,
and it's okay to set that boundary. And I think about that similar to how we talked about with Craig. If someone you love is struggling with addiction and not seeking treatment, as he said, the best thing his parents ever did for him was nothing. Because they have to want it for themselves enough to seek support. And so as hard as that is, and I can speak to that from experience as well, setting that boundary of, I love you, I'm here for you, but if you're doing X, Y, Z, I can't have a relationship, or I can't have communication with you. And that's hard, whether, especially if it is like a parent or a child or a spouse, it is really hard to turn your back or feel like you're not turning your back, but you feel like you're turning your back on them. But that's self-preservation. At some point, you're responsible to take care of yourself. And we've said over and over again, like it starts with you, and you got to take care of yourself first before you could ever be of support to somebody else. And so you've got to keep your eye on the prize there, and that's you first and foremost. And so it is, that's what I mean. It's so overlapping in so many ways, but such great takeaways. Just to know that like you're not alone, that a lot of people love somebody that is struggling in some way. And whether they're able to manage it, at times that's wonderful, or maybe they're not. Maybe it's something like a terminal illness or something like that. And that's a little bit different. But there is some overlap in that, maybe the way that person feels as far as powerless in a lot of ways. But just remembering that, when you feel powerless, the number one thing you can do is take care of yourself.
Yeah.
Start with yourself first. Do the things that make you your best self. And then, and I believe only then, can you provide anything to anyone else in this world.
I agree. And if your answer to that question is, I don't know what to do for myself, go get help. Go. Just go.
Get your support network in place. Who are your people?
Yeah.
Who can you trust? Who listens? Start there. Because they probably have some same things that we talked about. They probably have some suggestions for you.
Yeah, absolutely. And we'll have a lot of great resources too that you can follow up on our website, and really encourage you to use that. One of them is going to be Psychology Today. They have an excellent directory of licensed professionals nationwide that you can look to find someone within your area, within your area of expertise, or diagnosis or whatnot. And so use that kind of thing as a resource. Your primary care physician, everybody's PCP has a list of other specialty providers.
They can put you in touch for sure.
Yeah.
All right. Well, check out our website, the LYLASpodcast.com. Check us out on social media at the LYLAS Podcast on Instagram, on Facebook, on YouTube. You can check out our channel if you don't already watch it. We are really focused on YouTube content moving into this year. We're going to be creating lots of fun takeaways and resources and things like that. So make sure you check
Mm-hmm.
out YouTube if you have not already. I think that wraps up this episode, number 45. Shout out to my big kahuna in the sky. Today marks 10 years he's been gone.
Aw.
Uh, so we'll dedicate this episode to him because God knows I love that man. And like I said, I'm not diagnosing, but I'm fairly certain that he struggled with mental health issues. And
Mm-hmm.
just got to say it out loud. No shame in that game.
No
Do
shame in
what
the
you
game.
can.
Cheers,
Get you.
Dad.
Cheers, Dad. Until next week, LYLAS.
We love yous.